Good afternoon. The theme of this session is to discuss future research related to the challenges and considerations pertaining to the risk of excipient contributions toward nitrosamine formation. As background, this slide shows a prevalent pathway that leads to the formation of such nitrosamine impurities due to these excipient contributions. These nitrosamines that are generated are termed nitrosamine drug substance related impurities, or NDSRIs. These nitrosamines constitute a different class from typical small molecule nitrosamines, such as N-nitrosodimethylamine, in that these nitrosamines share structural similarity to the active ingredient. And the root cause of this is quite simple. APIs often contain secondary amine functional groups, and these secondary amines can react with residual nitrites, often present in excipients, to generate NDSRIs in the drug product, either during manufacture of the drug product and/or shelf life. In addition to this failure mode, if related secondary amine impurities are present at high levels, residual nitrites in excipients can also react with these to generate nitrosamines. For example, recent publications show the likely reason for the formation of N-nitrosodimethylamine in metformin arise from the residual dimethylamine impurity, a byproduct of metformin synthesis, which later in the drug product, when exposed to a nitrite source from excipients, generates N-nitrosodimethylamine. An important challenge in this area is that in contrast to nitrosamines that are generated in the drug substance synthetic pathway, where purging or purification steps can be used to remove these undesired impurities, in the drug product, it is not possible to remove NDSRIs once generated in the formulation. We are looking forward to the public comments as we address future research needs in this complex area. Thank you.
Good afternoon. Welcome to the excipient subsession on nitrosamine impurities. My name is Ruthie King, and I'm the Deputy Director of the Division of Pharmacology Toxicology Review in the Office of Safety Evaluation within the Office of Generic Drugs. My goal is to describe a few of the current challenges and to highlight opportunities for research to inform nitrosamine safety assessments. There is extensive published literature on nitrosamines. They are a cohort of concerned compounds needing tight control due to their risk as potent rodent carcinogens and probable human carcinogens. Yet their discovery in our drug products in 2018 highlighted that there are many data gaps. Nitrosamine chemistry of formation, their reactivity and stability, and mechanism of action of carcinogenesis are not fully understood. Safety assessment is complicated as there are many sources of nitrosamines, including their formation endogenously and their presence in food, water, and our environment. How do we consider all of these sources of nitrosamines when assessing their risk from drug products? Importantly, formation of nitrosamine drug substance-related impurities has posed a new challenge. Excipients in the formulation can give rise to these NDSRIs, many of which are data poor. That means that there is little to no compound-specific safety information to assess their risk. Optimized testing conditions for hazard identification and risk assessment are being investigated. In the absence of empirical data, risk assessment of NDSRIs is currently being done using structure-based modeling, computational toxicology or QSAR, and expert knowledge. However, the models themselves are data poor. Therefore, empirical data are needed to build stronger models to facilitate safety assessment of nitrosamine impurities, in particular NDSRIs. To fill these data gaps, collaborative efforts are needed to facilitate risk assessment and to develop effective control strategies for nitrosamine impurities to ensure safe generic drugs for American patients. We hope you find this afternoon's presentations and discussions engaging. Thank you for your attention. This is the list of speakers and panelists for today's subsession.